Leptospirosis. It's a big word for a serious threat to dogs. And guess what? It can affect humans too. Anyone who's cared for a sick dog knows how devastating leptospirosis can be, both for the pet and the people who love them. That's why this guide covers everything you need to know about leptospirosis, what it is, how to recognize the signs, and most importantly, how to keep both your dog and your family safe. Knowing the dangers of leptospirosis is the first step to keeping your pet safe. Many dog owners haven't heard of this disease, but it's more common than you think. The good news? With a bit of knowledge and some simple precautions, we can keep our dogs happy, healthy, and lepto-free. Think of this essay as your guide to understanding and preventing this sneaky disease. Let's dive in and equip ourselves with the information we need to be responsible pet owners. Leptospirosis is a bacterial infection. These bacteria live in the environment, in water, soil, and even in infected animals. Dogs can become infected in a few different ways, often without us even realizing it. The most common way is through contact with contaminated water. Think puddles, ponds, lakes, or even just damp grass. If an infected animal has urinated in the water, the bacteria can survive there for months. Another way dogs can get infected is through contact with wildlife. Wild animals like rats and raccoons can carry the Leptospira bacteria. If your dog sniffs around areas where these animals live, or even worse, tries to catch them, they could be at risk. Direct contact with infected urine, even dried urine, is another way the disease spreads. This is why areas with poor sanitation or a high rodent population can be risky. Remember, dogs explore the world through their noses. Leptospirosis can be tricky. Sometimes dogs show no symptoms at all. Other times they can get really sick really fast. Knowing the signs is crucial. Early detection can be life-saving. Some common symptoms include fever, loss of appetite, vomiting, diarrhea, and lethargy. Your dog might seem stiff or sore, reluctant to move. Increased thirst and urination are also red flags. In severe cases, leptospirosis can cause serious damage to the kidneys and liver. You might notice your dog's urine turning dark brown or orange. Jaundice, where the whites of their eyes or gums turn yellow, is another serious sign. If you notice any of these symptoms, don't wait. Get your dog to the vet immediately. Remember, early treatment is key to fighting this disease. Diagnosing leptospirosis involves a combination of a physical exam, blood tests, and sometimes urine tests. When you take your dog to the vet, be prepared to answer questions about your dog's environment and recent activities. The vet will examine your dog thoroughly, checking for fever, pain, dehydration, and other symptoms. They'll feel your dog's abdomen to check the size of their liver and kidneys. Blood tests are crucial for detecting signs of infection and organ damage. The vet will likely draw a small amount of blood to look for specific antibodies that indicate exposure to the Leptospira bacteria. Urine tests can also be helpful, especially if your dog is showing signs of kidney problems. The vet will analyze the urine for protein blood and other abnormalities. The good news is leptospirosis is treatable, especially when caught early. Treatment usually involves a combination of antibiotics to kill the bacteria and supportive care to manage symptoms and prevent complications. Your vet will likely prescribe a course of antibiotics, which your dog will need to take for several weeks. It's crucial to follow the vet's instructions carefully and complete the entire course of antibiotics, even if your dog starts to feel better before the medication is finished. Depending on the severity of the infection, your dog may need to be hospitalized for intravenous fluids and medications to support their kidneys and liver. Early intervention gives your dog the best chance of a full recovery. Preventing leptospirosis is always better than treating it, and the best way to do that is through vaccination. Talk to your vet about getting your dog vaccinated against leptospirosis. The leptospirosis vaccine is highly effective and can significantly reduce your dog's risk of getting infected. It's typically given as a series of 2 initial shots, followed by annual boosters. Besides vaccination, there are several practical steps you can take to minimize your dog's exposure to the bacteria. Avoid letting your dog drink from stagnant water sources like puddles, ponds, or ditches. Keep your yard clean and free of rodent attractants like pet food or garbage. If you live in an area with a high rodent population, talk to a pest control professional about safely managing rodents around your property. Remember how I said leptospirosis can affect humans too? It's true. It's a zoonotic disease, which means it can be transmitted from animals to humans. Humans can become infected in the same ways as dogs, through contact with contaminated water, soil, or the urine of infected animals. That's why it's so important to take precautions, especially if you have dogs. Always wash your hands thoroughly with soap and water after handling your dog, especially after being outdoors. Avoid contact with your dog's urine and clean up any accidents immediately using gloves and disinfectant. If you think you may have been exposed to leptospirosis, see your doctor immediately. Early diagnosis and treatment are crucial for both humans and dogs. Protecting your dog from leptospirosis involves a combination of vaccination, minimizing exposure to potential sources of infection, and practicing good hygiene. By taking these steps, you can help ensure your dog's health and well-being.